Thank you for staying tuned. Healthcare remains a top priority for the Tinubu administration in 2025 and even till now, as a series of far-reaching reforms deliver tangible relief to Nigerians while laying stronger foundation for a more resilient and inclusive health system in the years ahead. All right, let's bring in our guests to look at the impact of these reforms we're talking about. Mr. Sidney Sampson, he's a founder and global managing partner, Sidani Group. Thank you so much for joining us, Mr. Sampson.
Thank you.
And I could say Happy New Year.
Happy New Year to you too. Thanks for having me on the show. Great.
So let's go to the very beginning from the outgone year when we heard from President Trump to cut foreign aid. He put the nation rather, on pressure, intense pressure, to look within. Governments at all levels, were on their toes to look at ways to enhance health financing and, of course, improve strategies by looking inward. Going by your assessment, how did the country now stay afloat later on?
Great. 2025 was a very interesting year. I would like to say it's a year that started with a lot of promise, and then some of the hopes got dashed, but it showed again the strength of our country and many countries and how we can truly be resilient as Nigerians. With the dissolution of the USAID, the country stepped up very quickly, and that was evident in the quick action that was taken by the Honorable Coordinating Minister of Health and Social Welfare in engaging with the President and the FEC to raise resources to fill the gaps that were going to become apparent because of the reduction in available funding. So the country reacted quickly and was able to fill financially a number of the gaps that were going to become apparent from what has happened. But beyond that, one thing that has also happened that put us even in a good position to respond appropriately was what happened in the year 2024, where a number of reforms were put in place by the Honorable Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate. And that was with the sector-wide approach to addressing the health system challenges in the country. Okay. And the sector-wide approach was basically trying to get everyone aligned around the same priorities and trying to reduce fragmentation. And in cases like that, those were the kinds of initiatives that really helped the country pull together the little resources it had to address the gaps that continue to plague the country's health system.
And talking about gaps, let's look at the universal health coverage. There is a target of 44 million by 2030. Already 20 million have been captured. For you, going by the target set and the level of, the percentage, we hear more than 70% or about 70% still pay out of pocket. That's something that is still being dealt with, and we know it's work in progress. But from the private sector perspective, you're in the private sector, and I know it can play a critical role in terms of support.
Yes, the number around 70% plus minus of Nigerians spending out of pocket for health care has been around for a good number of years now. And I know that the government, the current administration, has done a lot of work in trying to change those numbers. There is the Health Insurance Act that came into full effect last year, April, that has moved towards mandatory health insurance coverage and has contributed to the numbers the reporter presented earlier in the show in terms of saying that there have been increase in health insurance coverage. And we know that, as it's said in Nigeria, in many African countries, that many households are just one major illness away from death and poverty. But with this new reform that happened and started last year, we are seeing significant change, and particular one to be happy about is the focus on even vulnerable groups, where you have the Vulnerable Group Fund. Yes. That's also part of the new plan, and with that we're seeing more people getting getting enrolled. But beyond that, there's also the Basic Healthcare Provision Fund, which is a wonderful initiative of the federal government that has gained a lot of momentum in the past few years. And as some of us know, there's been a recent launch of the Basic Healthcare Provision Fund 2.0, which even aims to build on the progress of the original BHTPF fund to reach even more households, reach more primary health care centers, and get utilization up, just like the Honorable Minister mentioned on the show earlier.
You know why I asked that question, Mr. Sampson, particularly because of the role of the private sector. We understand that certain services are not covered under the insurance scheme, and those that are covered in some private hospitals, according to reports, you don't get to receive such services because of lack of cooperation. They're not ready to key into it. That's why I'm asking the role the private sector can play to support the federal government.
Excellent. So coming back to that, interestingly, I met with I was at a hospital yesterday, and this particular situation came up around health insurance, the NHIS or NHI, the National Health Insurance Scheme, and how it's been functioning. First, from the private sector angle, one thing my organization, Sidani Group, has done is, of course, ensure that every single member of staff is fully covered, which again contributes to the pool of covered Nigerians with health insurance. And we make sure we cover them with the right and high quality insurance coverage to ensure that they can access the right care for themselves and their families. But one challenge that has always been there for the private sector, and I think when you mentioned the private sector is not cooperative, I'm not sure that's exactly the way it is, because most private sector organizations that are serious about what they are trying to do and care about their people, they ensure they are covered. So long as the right incentives are there. And for us, a global organization like Sidani Group, we make sure that is the case. There are different components. The NHIS is there, and the work that the private sector organizations have to do. And you know, when you talk about private sector, it's also a very broad range. There are the micro, enterprises to the SMEs, and all at different stages. Yeah. And the question always is, what's the incentive for that organization that has just 2 or 3 personnel, or 5 or 10, or that's making a turnover of a few hundreds of thousands in a year? What's the incentive for them to really cover the people working there? And how is the government supporting them to do that? And we know that in Nigeria, a lot of the enterprises are within that category. So for every entrepreneur, the question always is, how do I balance revenue and expenses, and how do I make sure I even survive in Nigeria's context? So
especially when it's a business.
Exactly. And so there's always that balancing act of how do we do this? So the question also is, how is the government supporting the private sector to better provide cover for their staff? And we know that the National Health Insurance Authority has put out a number of interesting initiatives to ensure that private sector organizations, regardless of their level, can find some place within their reforms to ensure that their personnel are covered.
At the end, it's just all about affordability, right?
Yep.
So, Mr. Sampson, we'll take a break when we... All right, Mr. Sampson, I'd like us to pick up with the primary health care. We saw the revitalization, 2,000, more than 2,000 thereabout. But at the state level, we saw what Rivers State is doing. And Kaduna State is another example. We're hearing reports of the state government remodeling and equipping 255 ward-based primary health centers. Now, that is quite commendable. But how can the subnationals, support the federal government to make it more expanded, so to say?
Thank you. The question around primary health care centers and their functionality is a very interesting one, because we know that PHCs are the first point of call for majority of Nigerians living in the rural areas and even in urban centers. The disconnect most times when we talk about primary health care is we talk about revitalization, and a lot of times it goes quickly to renovation, and you have these fancy looking renovated buildings, but the services, workforce,
yes,
commodities, drugs, people, are they there to provide this? And the federal government cannot do all of that. The federal government can do part of it and part of its job, which is helping with revitalizing some of those primary healthcare centers. But we know that the PHC work has the states having to contribute, even the local government areas having to contribute. So the health workforce a lot of times has to come from the state. So how much is the state doing in employing the right quantity and quality of health workers to be in those revitalized primary health care centers to really provide the quality that is needed in terms of care? What about the commodities? The federal government at best can give seed funding and do a few things, but again, the state has to take full ownership of providing those commodities through the drug revolving funds and having their DMAs functioning appropriately to ensure availability of the right essential commodities for care. So a lot of times when we talk about primary healthcare centers and their functionality, we have to understand the multi-layered elements that are involved in making sure that a PHC is actually functioning, but not just functioning, but delivering high quality care to the citizens that want to access care in those locations.
And the workforce we're even talking about, we hear a ratio of 3.9% to 10,000 per person. That is an issue that was really debated on in 2025, especially with seeing our doctors leave the country. What should be put into consideration going forward to ensure that we have these doctors, stay?
Excellent. Interestingly, Sidani has been doing a lot of work in human resources for health, and we've done a number of in-depth analytics to understand really the drivers, and we've proposed different very interesting strategies, which I won't go in details here. But one thing that has come out clearly in the need for our people in terms of doctors and health professionals is motivation and pay. Because of the global nature of work these days, a lot of our medical practitioners are exposed and have seen the different levels of remuneration across the world. And given the openness to, as we call it, Japa and all, people are able to move around and seek greener pastures. But one thing that's been clear is the fact that if you have people closer to the communities engaged, and you actually get the communities to also own the functionality of these facilities and also the people there, then you have higher chances of the medical practitioners. And for PHCs, while doctors are advised to be across every PHC because of the limited numbers we have, there are now other models that are also coming up in terms of health workers that can also provide care. And on top of that, we also have digital health coming in very handy, where you're having telemedicine also coming in to fill some of the gaps where an experienced medical doctor or practitioner can, from a distance, support multiple primary health care centers to provide good quality care within their locations. But ownership and accountability and better remuneration is key if we have to turn the tide around in terms of availability of the right manpower within the primary healthcare centers in our communities.
And one critical aspect that the tide turned around, we saw immunization expansion. We even saw the introduction, rubella, measles. Vaccine was introduced again, and also the malaria vaccine. But that requires a lot of investment, particularly from the private sector. Maybe because, Mr. Sampson, you're from the private sector, and I'm trying to get your insight on what you think can be done to support these initiatives, because we saw the strides recorded, even though there are gaps in the aspect of awareness, access to these vaccines in hard-to-reach areas and all of that, but there could be more that can be done, right?
Absolutely. Okay. And we know that, yes, the measles rubella vaccine was introduced, and it's one of the largest such vaccine introductions globally. And the Nigerian government did a great job of reaching a very high percentage of the target population across the country. But one thing that's clear with such introductions is not just the initial campaign, as it's called, and the introduction. It's the sustainability of the levels that we've reached.
Yeah.
And that is where private players like ourselves, come in to support as implementing partners, to support the government, not just at the federal level, but also at the states, to really drive the implementation, to sustain the momentum that the country has gained with that introduction. And like you mentioned, even for the malaria vaccine, that's been introduced almost 2 years now across in a number of states. And I know there are plans to expand the states that are receiving the malaria vaccine. Now, that's a very expensive vaccine.
Yeah.
And it's one that requires a lot of efforts to ensure that every single dose gets to the children that need them. And given that you have to reach those children more than once, that no child is lost to follow up, that each child gets the full 4 doses of the malaria vaccine. And again, a lot of efforts need to come in there. The federal government already provides the vaccines, pays for those vaccines. I wouldn't say they provide them for free because they pay for them. But the state governments now have to also play an active role in ensuring that the health workers are there, the demand and awareness are created, and people know that these vaccines are there and are able to take them, and also works with the right gatekeepers within the communities to dispel any negative information on the sometimes negative impact people would say of these vaccines, which in most cases are just, as they call it, adverse effects following immunization. So the states have their role to play, the federal has its role to play, and I think it's doing a great job with that, but there's still a lot more to do. And like I said earlier, it's been able to maintain the momentum and not backslide, because a lot has already been done and a lot is still being done to ensure that Nigerian children are protected and the PHCs are functional.
And one strategy to get more expansion is investment in local manufacturing of this vaccine, enhancing or rather strengthening capacity for the country. I see the ministry go into partnerships with the private sector, even the international community. How can this be sustained going forward?
The conversation around the local manufacturing of vaccines and other health commodities is a very, again, interesting or rather complicated conversation. It's one that has been on for many years, yeah. And I'm glad to see that the current administration is taking this very seriously and is taking very concrete steps to move from where we were to a place where we actually see local vaccine manufacturing become a reality. It requires a lot of investment, and one thing that we have seen is beyond just the appetite to have it, a lot of factors have to come together. You have to have the right manpower. It requires very high skilled personnel. It requires a lot of stability in terms of also power. It requires assurances in terms of market to
The market will always be there based on demand.
Yes, the market would always be there, but the market is also a global market, because at the end, while you are trying to produce that, there are also global forces that produce these vaccines, and if they produce them at much cheaper rates than you are able to produce, then it makes it counterintuitive, because then you'll be spending more. But the fact is, there is hope. There is hope that if we're able to crack this, we have the West African market, we have the African market, and a lot of countries are also having conversations on how to move this conversation forward, working with organizations like WHO and Gavi and all.
All right.
But yeah.
Mr. Sidney Sampson, we'd like to leave the conversation there, but I like the word you picked, hope. Let's keep hope alive. It's the renewed hope era, right? So thank you so much for coming on Weekend File. We do appreciate. He is the founder and global managing partner, Sidani Group. Thank you.